From Washington, D.C. to the Central Coast, this is Focus with Farr, where our representative in Washington hosts in-depth discussions of important issues of the day. And now, Congressman Sam Farr.
Hello, welcome to another session of Focus with Farr. We've been having a lot of discussion here in Washington about three things: healthcare, healthcare, and healthcare. We've also had a lot of discussion about unemployment, which has a relationship to healthcare, and obviously right now a discussion about Afghanistan. But in my town hall meetings in the district during August and September, we were able to have 7 town hall meetings discuss healthcare. It's now down to the bills being brought together from the various committees into one bill, and we ought to be voting on the rule for the debate on that bill hopefully next week. So I thought I'd today summarize what is in this bill and why it's so essential that we in the United States of Congress address the health care issue or lack thereof. And I have with me today a very distinguished career person who knows how to talk about these things because she's involved an entire life in it, beginning with being a staff member here on the Hill for our late Congressman Bob Matsui, who served from the Sacramento area. And Kathleen Stoll is here today as the director of the health policy at Families USA. Her specialty now is being able to describe how federal policies will affect states like California. And I thought for a person who has such a great working knowledge of the issues relating to this healthcare reform in America, insurance reform in America, that she'd be an ideal person to bring on the show and discuss these issues with you. So thank you for coming and welcome to Focus with Farr.
Thank you. I'm really glad to be here. I have a place in my heart for California.
I wanted to ask you, Kathleen, we've been discussing a lot about how to fix the healthcare problem. But I think we haven't done a very good job of explaining to the people what's broken and why do we need to fix it. And maybe we ought to just, for a moment, just talk why, if we do nothing, what happens?
Well, there's a tremendous cost to doing nothing. Let's start first for people who have insurance. Right now, the average family premium is about $13,000 a year. And that premium has grown about 5 times faster than wages since 2000. And that trajectory of rapid growth that far exceeds any wage growth is going to continue if we don't do something. Some predictions are that by 2016, folks will be, instead of paying $13,000 for family insurance, which is already very unaffordable, the premiums could be more like $22,000, $23,000 a year. That's not sustainable.
That's not sustainable, and what it does is, if you think about it, if your wages haven't grown, your COLAs don't increase, your income doesn't increase, that means that of the limited income you have, that you're planning for a family vacation or planning for a birthday or a holiday season, that money is no longer available because you're spending it all on health care.
That's exactly right. We've seen statistics at the national level that about 14 million Americans who have insurance spend more than 25% of their pre-tax income on health care costs. So not only are the premiums growing, but your deductibles and what you pay for services, those co-pays, are growing. You know, in the end, families are seeing their paychecks not only not growing, but they're getting gobbled up by health care costs. And that is part of what reform will fix. It is going to slow down not only the growth in premiums, but protect people from those high deductibles and high copays.
And because of that cost in premium and cost in copay, that's why so many small businesses or businesses are dropping the benefit they're giving their employee. And we have always assumed that so much of the health care insurance in America would come from your job, from your employment.
That's right. That about 170 million people get insurance through their employers, but there's a huge crisis among small businesses. The rate of offers of insurance to workers among businesses smaller than 10 is less than a third. So small business owners, and my husband's a small business owner, they want to do the right thing by their workers. They want to offer coverage. They can't afford those kind of prices I was just describing. So we need to give help to small business.
So if we do nothing, and just leave it as it is, we're going to bankrupt the individuals, we're going to bankrupt small businesses who won't be able to take that new revenue or success that they have and invest in growth. And as far as American corporations that are competing internationally, where you have other countries that have solved their healthcare problem, a lot less costly than America. So essentially American enterprise, American businesses will be under incredible threat from foreign competition because they don't have to pay so much for healthcare. So it is really a huge financial issue for this country, not just an issue of fairness and right to have access to healthcare.
Absolutely. I'm actually an economist by training, and there is no way we are going to achieve the kind of productivity and sustained growth in our economy that we need right now coming out of a recession if we don't address healthcare costs. They affect large employers. They are really wiping out small employers. And for the individual entrepreneur who might want to start a business, which is really the heart of how we grow in this country, folks can't afford to walk away from the job they have now and be in this individual market that's completely unregulated in almost every state in the country. They can't buy insurance, so they can't go out and start that new business, take that new idea, and run with it. So it hurts us in many economic ways, and there is also, of course, a moral and ethical issue that underlies this.
So in essence, we're kind of stuck. I mean, we're getting worse because it's costing more, less people can get access to it, and we're kind of drowning in this cost, and we've got to fix it.
Absolutely.
Now, and we have a lot, there's a lot in these bills, and because there's a lot to fix. It's not just one thing. It's a whole. It's how you're, the health prenatal health care and then all the wellness that you want to invest in people. I was thinking this morning, they say, well, government shouldn't be doing this. What's the prevention program you think of most out there that has really been effective? It's fire prevention. And who does fire prevention? We have public fire companies and public fire folks that go out and talk about it. We have not invested in the prevention of illness, sort of the wellness aspect, by essentially investing in it like we have invested, and the media carries the investment of why you need to do fire prevention. So I think there's just so many aspects of this bill. So when we put this together, what's it going to do for the insured individual? Why is this better for somebody who already has insurance? And I guess the other side of that is, what's it going to do for people who don't have insurance?
Right. Well, first of all, I think it is really important to emphasize that this bill has a lot of improvements for people who now have insurance. The first thing, and we've heard our president say it, and as a consumer advocate, I'm here to tell you it's absolutely true. If you have employer-based coverage that you like, right now you can keep it. It will not have to change, and that's quite clear in all the bills.
Will it get cheaper?
It very well may. It will, in fact, definitely turn down the curve of cost growth. It probably means that a lot of employers will have a lot more choices in the kinds of plans they can offer, and a lot of small businesses will have the advantage of being able to pool themselves together and purchase coverage through the exchange. All the businesses, large and small, will get the advantages of some reasonable and fair regulation of insurance products. Now, I'll tell you honestly, I'm a capitalist. I really am, and I like competition. So I think what you want is to have structured competition. You want the insurance industry to be able to compete, possibly with a public plan as well. We can talk about that in a bit. But you want the rules of the game to be fair for the consumer. You want to make sure that people understand what they're buying, whether it's the employer buying it or the individual. They understand what they're buying. They know that they're getting value for their dollars.
Well, I like to point out that in my public career, serving in state, federal office, local office, is that demand for fair play actually comes from businesses. You don't want to go out and have a process where you've gotten a license or a credential and find that your competitor doesn't have to have that or doesn't have to abide by any of those rules. So a lot of these rules actually come out of the business itself. We call it a level playing field, that the people I'm competing with next door or in another state ought to have to abide by the same regulations that I abide by. And I think that's the fairness in this. And one of the things that we're doing is we're standardizing that so that the basic plan that everybody will offer will all have the same ingredients. And because the plan will say to insurance companies, you can't have pre-existing conditions, essentially treating the entire United States as one big group. For example, I'm a federal employee. No one asks me when I sign up for federal health insurance, do you have a pre-existing condition? What's your family's health issues? The doctor may want to know that, but the government doesn't want to know it. And the insurance company isn't allowed to ask us because they've agreed to sell us insurance. And that's essentially, I think, the way these new regulations on healthcare are going to make everybody in the United States a one big pool of people you can insure.
Exactly. That's a good way to think about it. A couple other protections. You mentioned pre-existing conditions. No longer will you have an exclusion of the very thing you need covered. Mm-hmm. You won't be denied coverage because you're not in perfect health. You won't have a plan that runs out on you when you get sick. Right now, a lot of insurance products out there will only pay so much money, and that's it. And if your healthcare costs are more than that, you're out of luck. That will change. There are no more annual or lifetime caps on how much an insurance plan covers, and there are great caps on how much you have to spend out of pocket. So a limit on your copays and deductibles.
And that's very important, the limit on your copays and deductibles, because that's where people, sort of the hidden language in these healthcare policies, they never realized when they were covered that it was limited.
That's right. People get burnt by that all the time. In my work, we have people calling and saying, well, I thought I hit my deductible, but I find out I have a separate and completely different deductible for this service or prescription drugs, and they're confused by what they have, and they find out it doesn't protect them when they need it. Another important...
So for those that are insured, what you've pointed out is, one, the policies are going to be clear. The cost of that policy may come down, the premium cost.
It'll come down.
The copays will essentially be eliminated. I mean, the caps will be eliminated. Is that for everyone or just based on income?
There will be stronger caps on what you have to spend out of pocket. So we won't require the lowest income people to spend as much out of pocket. There's a sliding scale. We ask people with more means to pay a little bit more. But for every single income level, there are new caps on out-of-pocket protections. Another important protection that's been in the news in California is the issue of insurance companies rescinding policies. So you've paid your premiums, you think you have coverage, and what happens is perhaps I'll give you an example, a real-life example. You have migraines, you have headaches. You never suspect it's something serious. You record that on your application for insurance. And later you find out you have a brain tumor, God forbid. And you never suspected that, and your doctor didn't suspect it. But the insurance company now says, because you didn't know somehow, some magical way, that you had brain cancer, and you only told us you had headaches, we are going to rescind your policy. We're not going to pay for your care for your brain tumor now that you really need it. This is a huge issue across the country. It's been a hot issue in California, and the healthcare reform bills that we're looking at will end that practice of unfairly rescinding policies that people have paid for.
I want to come back to how to be implemented in the states, because this has really been a national debate about health care in general, but we sometimes forget that all of the licensure process, licensing doctors, licensing nurses, licensing insurance companies, licensing the whole scope of practice is a state function, and that isn't changed by this. I guess the question that a lot of people have on the interstate issues is, should health care insurance be sold on an interstate basis like we have interstate banking? I reminded people that I was in the California legislature when we went through that, and it was a big shift because you really had to have at least a not lowest common denominator of protection in the United States, which some states have, and attract businesses to incorporate there. California requires that you have to meet some standards that are high, and I'm sure that even if we do have interstate healthcare insurance, it will have to meet some high standards in order to be sold in big states.
There's some variation across the bills about the level of the exchange, national versus state, but the bottom line is that states will still be able to protect consumers in ways that go above and beyond the floor of protections that the federal government wants to create. So in California, if you were to want to add an additional protection, you'd be free to do that. Plans that come into your state then would have to comply, just like they do now. But we're trying to create some standard or floor for everyone. And there are states, and frankly, California isn't the worst state in the country by any measure.
No, I think frankly we're in many ways at least the menu of services is much higher than most states.
Right, but there are colleague states. I'm actually a resident of West Virginia when I'm not here in Washington, D.C., where the regulation is much thinner, and so we want to make sure people with insurance are protected in all 50 states. But we won't undermine any of the protections that a state like California has created for their residents.
Well, let's discuss this whole reform on how it's all going to work, which is essentially an exchange, which is everybody, that's kind of a complicated word. You don't understand it. It's not a swap meet. It's essentially a one-stop kind of place you can go and shop insurance. You can go to, and you have comparisons there. So and that'll be all the insurance companies will be in that exchange. So as you as a consumer, you can say, well, if I want to, maybe I have a Blue Cross and I want to see if anybody out there is giving me a better policy.
Right. That's a good explanation. The exchange, sometimes it's called the gateway, is really a marketplace where private insurers will be able to offer their products and compete with each other. The requirements, though, are that they're transparent about what they cover and how much they cover and what they cost, and what those deductibles are and copays. There will be standard products that have to be offered, so it'll be easier for consumers to compare.
By standard price, you mean a basic plan, and then you could have a stepped-up plan, you could have a Cadillac plan. There'll be options for the consumer to choose, not just, but everybody will have to have a standardized basic plan.
That's exactly right. There will be sort of a minimum level of things that have to be covered, so we know that prevention is covered. We know that you don't have surprises. Then there will be a number of tiers, and you can pay more for a better plan. That's your choice. This will actually make it easier to understand your choices instead of taking away choices. It'll make it easier to compare, just like a Consumer Reports magazine might help you look at a toaster. Well, what's a more important purchase in your life than your health insurance coverage? And you want to know exactly what you're getting for your dollar. There's so many hidden clauses in insurance policies right now. We get calls every day at Families USA where people are surprised by the small print, and I do mean small print. So that's going to change. This marketplace will be regulated in reasonable ways. The products will be standardized. You'll be able to go out on the internet in the same way that you shop for other products and compare. Really important part of this new regulated marketplace is that for people below about $90,000 for a family of 4, there will be additional help with the cost of insurance, subsidies for the cost of premiums. And that's going to make a tremendous difference for many, many people. Not everyone has an offer of coverage from their employer. Often the employers pay a fair share of that premium, but for many folks they don't have an offer at their place of work, and they'll be able to get subsidies in the exchange. They're generous, really robust subsidies. They're larger for lower income folks, but they go all the way up to $90,000 for a family of 4.
Let's discuss for a moment the public option, and there's some other terms for that, because people are very confused. There's been a lot of negative messaging on the public option. What we're having here is the government creates a non-profit entity, which is an insurance company, that has to abide by all the rules that any other insurance company has to abide by, and has to be financially sound. The difference is that with a non-profit, you don't have to pay dividends on stock for stockholders, and you really don't have to do advertising in that way. And essentially this is a entity that will allow a limited, what I call limited entry at first instance, because not everybody's going to be able to get in there. You're going to be able to, you would go to the exchange and you can only get in there if you can show that you can't afford what's the products that are on the exchange. And then later on, as it matures and gets financially sound, it will be, I think that's in the bill, that it eventually becomes on the exchange as another option. And it seems to me that we need to have that for two purposes. We need to have it for people who just can't afford what the private sector is selling, regardless of how competitive they are. And we need to have it to keep the private sector kind of checks and balances, that if indeed you have to be financially sound, then why not see if somebody can produce this a little bit cheaper. And but I also think it's going to drive these public, they want to sell insurance. I think that the private sector has been very good at being able to reach out to a big market out there and say, my God, if we could have that many people signing up for our product, we're going to make sure that it's very attractive.
Yeah, I think we at Families USA, from a consumer perspective, strongly support a public plan option. There's different variations on what that might look like, but the core principle is that private plans should be able to compete on a completely level playing field with a product that the government offers, and that will help make everyone operate more honestly. It means that we will actually help lower premiums across the board, whether you're choosing a private or the public plan option. And that's the advantage of it. It really is another piece of competition. It's another new choice. I struggle because those who oppose it really talk out of two sides of their mouth. On one hand, they say that it will operate so efficiently it will put private plans out of business. I don't believe that in a minute. On the other hand, they say it will be inefficient government-run health care. Well, those don't fit together for me. Probably the truth, and I think quite honestly the truth is it will provide a good product, it'll be at a good price, and it will first force the private insurers to look at their pricing structure and see how they can compete. There'll still be room for profits in the private insurance industry. Whether there'll be room for CEO salaries that are in the $100 million plus range, I don't know that will be possible, but I'm not too troubled by that. I think they'll still do okay.
Well, that what I think will be good is that the board of directors of these insurance companies will really have to decide whether they want to be just in the big profit, extreme profits, or they willing to provide a health care package that is affordable, and you got to cut somewhere.
And you know, I actually have a lot of friends in the insurance industry. I was talking with some friends last night, and they feel that as long as the rules of the game are fair to them and there's a level playing field, they're willing to go out and compete. It's only a few insurers who are afraid of competition that fortunately have often loud voices.
Well, I think you're absolutely right. I mean, the insurance companies have essentially been in the fire insurance, the automobile insurance, and life insurance. I mean, they're competing on a more level playing field than they are in the healthcare business, where essentially they have all these loopholes that they can do with pre-existing conditions. So the fairness is wonderful for business. The competition is great. But I think the best thing of all is that you and I and everybody else will have a choice, and that everybody's going to be covered. We're not going to have people in America without some kind of coverage.
That's right.
And that is essential if we want to have a healthy country and a strong country. I mean, it's really part of our national security if you think about it.
That's right. Also, if you think about right now, we're all talking about H1N1, you know, the flu, and I want to get my vaccine as soon as possible. How do you really monitor an epidemic occurring within your population if 50 million people are not in the healthcare system? And it's actually a much larger number than that. Those are people who are uninsured for a full, neat and tidy calendar year from January to December. If you look at people who are experiencing 6 months of uninsurance in a 2-year period, the numbers start going up to 1 out of 3 Americans under 65. And exactly right, because they're unemployed, they're uninsured. That reduces our ability not only to grow the economy, and our productivity, but it also reduces our ability to do good public health measures and to monitor epidemics. It harms us in so many ways when such a large block of our nation's citizens are outside of the healthcare system.
Well, I think that's what we've done in our public policy in schools, is we want every child vaccinated, because that one sick child can infect an entire class, an entire school, an entire community. So it's better to make sure that everybody's covered than not. And the same saying goes for this country, is try to keep people well and healthy, and if they are sick, get access to medicine right away, and not based on the fact that you don't have insurance. Right. Let me just ask one thing, because we only have a couple of minutes left. I want to just cover the one thing to ensure our seniors that that their Medicare is, in fact, what's in this bill for those of us in the Central Coast is a Medicare increase, because we are paid at the lowest reimbursement rate in the United States and living in some of the most expensive counties in the United States. And so what's happening is the senior citizens are being denied access because doctors will not pick up Medicare patients. We've had problems always with Medi-Cal, but Medicare has not had a problem here up until recently. And it's a huge problem for us. So there is a fix for senior citizens in our area that will now, the doctors will be able to get the same reimbursement that they get in the San Francisco Bay Area and in the Los Angeles Greater Basin. So that'll be one improvement. But other improvements are also in this bill.
Right. Well, first of all, absolutely no benefits are being cut for seniors and people with disabilities in Medicare. What we are doing is, one, we're going to provide no cost sharing for preventive services. Right now, seniors and people with disabilities pay co-pays on preventive services. That's eliminated. That's a benefit improvement. More importantly, the so-called donut hole in the prescription drug Part D benefit, which is you pay 25% of drugs and you hit about $2,700, and then you have to pay for your drugs completely out of your own pocket. And it goes over for over $3,000, you're stuck with the whole bill yourself. That's called the donut hole. And seniors cannot afford.
We close that hole.
Right. You can't afford to pay that out of your own pocket. The House bill closes that hole. It takes a few years to do it. You got to do it in a reasonable way. In the meantime, seniors will get a discount, 50% discount on brand name drugs. These are huge improvements to the Medicare program.
So we're gonna make it better for senior citizens and people on Medicare, not worse.
Absolutely.
Well, I want to thank you. We've spent the time here so quickly, and I want to thank you for coming on this program, and hope you, the viewer, have been able to better understand the healthcare issues in America and what we in Congress are doing to fix them. Thank you for watching.
For more information, contact one of Congressman Farr's district offices. You can also reach Congressman Farr in Washington or visit his website.